Welcome back to my channel. I know it's been a while that I've put out content. I'm sorry. It's life and dealing with life. But yeah, I'm back. And this morning I would like to talk about bedside manners in Nigerian hospitals. Now, this stems from some of the experiences that I have had as a person in my family, collectively, and maybe even with friends. So I hail from Nigeria and I was pretty much a healthy child, but I had more cause to go into hospital, deal with doctors and nurses when I got married and I started having kids. I have experienced antenatal, prenatal care, postnatal care, birth and delivery at home in Nigeria and here in the United States. And I will tell you that the difference is very clear. I'm not even talking about the whole healthcare system now. I know that healthcare system in Nigeria compared to or versus United States, there's a wide gap to be filled. There is it's just something else. But I believe there is this component that if doctors, nurses, and healthcare system in Nigeria focus more on, it could help us drive better care in Nigeria. And that is bedside manners. Yeah, what is bedside manners? It's pretty much the communication, the relationship, or the way doctors relate with their patients. And I have found out that there is this way that they do it back at home in Nigeria versus developed countries like United States. And I feel like it's causing more harm. In Nigeria, for instance, the doctors speak over you. They kind of like lord things over you. Yeah, I'm being blunt because honestly, I'm pissed with that. I'm pissed with the system. I'm pissed with the things they make us go through. When someone is in pain, when someone is already like frail or vulnerable, I think the least you could offer the person is good bedside manners. You don't want them to feel worse than they already do feel. The chief experience officer for Cleveland Clinic was interviewed a few years back on this topic we're talking about. Cleveland Clinic is in the United States, and he said a few things that I would like to bring to light in this discussion. Now, first, he said when nurses have better bedside manners, safety issues like medication errors, fall, and even pressure go down on the side of the patient. And then he said for doctors, it is actually quality issues that go down. And this eventually will drive better healthcare delivery, better healthcare for the patients. And they are looking at how directly this is linked to patients getting better overall. Some of the quality issues that is actually addressed when doctors have better bedside manners is that apart from better coordination with nurses, compliance with treatments go up with patients and their family members. And this is very important because from my experience back home, from my experience in Nigeria, it seems more like doctors are commanding and telling you this is what must be done, this is what should be done, versus when you are here in United States, and I want to believe in UK or maybe in Canada, they are actually carrying you along. They make you know that your opinion counts. I'll tell you, my first one I had at home. I was going to have cesarean section. It was unplanned. It was more like maybe within a week or two they started looking at it because of the situation surrounding my baby. I was going to have a small baby, and fortunately for me, I dealt with Dr. Oshudi in the Solo local government, and then I was using Jolad originally, but some people advised me that being my firstborn, which I think it was a good advice, I should have General Hospital, government hospital as a backup, which I did. Dr. Oshudi at the time was a consultant and he handled that case very well, very professionally. He told me why they are considering C-section for me. And I was very grateful for that because I went in more confident about the cesarean section. So I didn't have to add the stress of thinking about cesarean section. I've never had knife on me before, so it was easier for me. But the problem was when I was going to have my cesarean section. Everything went well. I had my baby, no bleeding, everything was perfect. But then I started bleeding. I observed by myself that I was bleeding on the side of the incision, and I called the attention of the chief matron of the theater to it, and she ignored it. But I knew that something was going on at my right side, and I'm like, maybe right side or left side, one of the sides. Like, this is wetter than the other. So that was how I was ignored. They could easily have wheeled me back into the theater and fix whatever needed to be fixed, but they totally ignored my complaint. I did that surgery in the morning on Friday. I've been in the hospital the night before. Other women went in after me. They did their own cesarean section. By the time it was the following day, they were already going around, moving around. Women were recovering. I was still stuck in my bed. Yeah, sorry if you can hear any noise, please ignore. It's just I'm at home and I'm trying to make this video ready. Okay, so other women were moving around and I was still stuck in bed because I was bleeding. My urine was not clear, everything. I was not recovering. What's the problem? My mom was my husband. We were panicking and everything. And eventually, when the doctor that operated on me came later in the night on that Saturday to look at me, I was already sore. So with that soreness, he had to, still inject me on that side because I was out of anesthesia, and it was pretty much like whatever they can just do there. And when he injected that side, I eased, and that was it for him. He just started talking. Why are you hissing? Blah 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 blah. It was something else. I am in pains. Literally, I was in pains. I was sore, and all this man could see is a reaction. Of course, he didn't even get it. That's to tell you, he still did not get the problem because he was focused on the feelings or the expression from the patient. And eventually, as God will intervene, because we started praying everywhere. My baby had not even seen her. Eventually, another doctor stepped in the Sunday morning. They got what was the issue. A very good bedside manner, Dr. Salako. I'm withholding the name. I don't even remember the name of the one that was rude to me or had that poor bedside manners, thankfully. For my other experience here in the United States, totally reversed. When I was going to have my second baby, it was going to be CS2. I remember my gynae advised me, I think we should bring out a baby. I had my baby shower set for a day after the day they eventually told me to come in. Of course, that has been fixed and preparations were in place. And I'm like, can I wait? When I told her, well, I wanted to go, I want to do that first, and then I'll have my baby later. I saw she didn't even force me or whatever, but I honestly asked for her opinion. And then she told me, this is what I think. I think you should come in right away. That is it. You're making me feel like, I have a say in my own birth plan. Do you know that even in the United States, you could draw out your birth plan, how exactly you want it to be. You can't try it in Nigeria. Trust me. And I'm saying that because of the recent issue that happened, which is what I think crystallized this video, that really, really made me want to do this video. My younger sister had twin babies in Nigeria, and the stress alone that this lady went through few weeks before the birth, the delivery, it was uncalled for. Totally uncalled for. Terrible experience. This was even a private hospital in Nigeria. At some point, they were suggesting that she had cesarean section, whereas she had a prior child she had herself without any issue. There was no need for cesarean section. And then, because there was no antecedent, even other doctors outside were like, it shouldn't have to be. But eventually, with the ups and downs, we agreed as a family and whatever, calming my sister's nerves. Okay, let's go. It's probably because of safety reasons. which she actually asked the doctor, why am I going? He couldn't give her any sane or cogent reason why she needs to do cesarean section. There was no need. The only issue was that one of the children was breech. That was all. Because she was going to have fraternal twins. Okay, because they were breech, are we not going to try first? And then if need be. They were on that for a couple of weeks. And then my sister was not fine. You know, I'm talking about psychologically and everything. But eventually, she calmed down. And then she was ready for the cesarean section. The next thing that happened was that the doctor went ahead to pick a date for a cesarean section without telling her, no information whatsoever, and just so that I've picked it, this is the date for you to come in, we'll do this, blah blah blah, we'll do this, give her own birth plan. And she was like, woo, this is too much. She didn't even want to go with the doctor again. She was like, I'll let God take control. Even though he was claimed the best doctor in the hospital, my sister just didn't care at that point, and we started praying, oh God, take control. Eventually somebody else did it. What am I saying? Poor bedside manners. Why on earth will you go ahead and make a birth plan for someone without asking them? In my case, I was fortunate when I was in Nigeria to have someone that even told me why. This is why we are considering. We don't want to put your child through stress. I see the bigger picture. I'm happy. I don't need to, argue. I don't need to. Which was what she needed. She needed that closure. She needed that understanding. But I don't know why it's so bad. It's so bad, and I feel like this is something that needs to be addressed. Actually, there's a lot of things that needs to be addressed in the healthcare system in Nigeria. But basically, I feel like these bedside manners should be a very intricate part of their training. So what I'm saying is this: it should be like something that they go when they are going to school, classes for physiology, for what else? What is logy? The way they treat that cadaver, that dead thing or whatever they work on, and let them be assessed based on that, because most of them or some of them are not doing good when it comes to bedside manners. Of course, my experiences here in the United States has been, I don't know, you want to have kids over and over again, if not for better bedside manners drives better patient care delivery, and is linked to better recovery or better compliance with treatments and medications on the side of the patient and on the side of their family members. It's very important, and I feel like it's lacking in the healthcare system in Nigeria. Please let me know what your own story is. Please let me know if you think I'm right or wrong about this bedside manner issue. Can you please put down your own experience in the comment section? How has it been with you if you're in Nigeria or back here in the United States? Did you have a better care? Let's know. Thank you for joining me on this channel. I hope you have taken one or two things with you, and I hope that bedside manners is improved in Nigeria. Please don't forget to like my video, subscribe to my channel if you haven't, and please click on the notification bell so that you'll be notified when I upload new videos. I'll see you later, and until the next time I see you, stay blessed. Bye.